So tonight we're going to be looking at glutathione and anemia. And you see the subtext is an underutilized solution because this is something that even our immunotech distributors are not aware of, unless of course they have a copy of my book. So let's look at glutathione and anemia. Anemia in general is a condition where the blood cells, the red blood cells, are insufficient in number or in function, because they're supposed to be getting our cells and tissues enough oxygen for normal function. In common speak, when I was in Atlanta, we would call this low blood. The most common laboratory test to confirm anemia, and you've probably seen this on your results in your yearly visit to your doctor, are measurements of hemoglobin or hematocrit. Although there's more sophisticated tests that exist, and those are used to shed light on the cause of the anemia. So hemoglobin and hematocrit. There are all kinds of signs and symptoms that you could find if you're anemic. You might be suffering from headache. You might just look pale. I mean, Doug, you were telling me that you check your dogs. You open up their eyelids and you look into their mouth and see if they're pale or not. Well, that's the easiest way to tell if somebody's anemic. You might be dizzy. You might have brittle nails. You may be having heart palpitations. You might have leg cramps. But the most common symptom would be feeling tired or fatigued. So for those of you out there who are feeling chronically tired or fatigued, time to get your hemoglobin checked. The incidence of anemia, it varies in different populations depending on economic factors, sex, age, and comorbid conditions such as pregnancy. And the highest level of anemia exists in pregnant women, menstruating women, and of course, the children and the geriatric population. Although numbers vary depending on which data bank you're looking at, it would be safe to say that between 10 and 20% of individuals suffer from anemia. So that could be 1 in 5 people. The treatment of anemia depends on the cause of the anemia. Often there's an underlying nutritional deficiency, something like B12, vitamin B12 or folate deficiency. The person might be losing blood. There might be insufficient red blood cells being manufactured by the body, or there might be an underlying genetic defect. So many, many reasons to be anemic. The mainstay for very severe anemia is blood cell transfusion. But this treatment may be unacceptable in certain populations. Some people are very concerned about catching a disease like HIV, AIDS, or hepatitis because of a transfusion, and this has happened in the past. And others have religious restrictions, like Jehovah's Witnesses, who will not for any reason, except without a big fine, a blood transfusion. So now let's get into the focus of today's call, of course, glutathione. As you know, glutathione is a small peptide that exists in every single cell of the body. It plays many functions, the most of which include antioxidation, detoxification, immune system support, and it has been referred to as the body's master antioxidant because it's the major antioxidant produced by the body itself, and all other dietary antioxidants require the presence of glutathione for their normal function. Glutathione is considered our most critical defense against oxidative stress and free radical damage. So the term master antioxidant is quite appropriate. Now, there are different classifications of anemia. In this article tonight, we'll separate these into one, destruction of red blood cells, two, decreased production of red blood cells, and three, loss of blood or loss of red blood cells, and this could be acute or chronic. Examples of these will be examined in turn, and we'll look at the possible role of raising glutathione in improving this anemia. Let's look at destruction of red blood cells, also called hemolytic anemia. Hemo refers to blood, lytic means breaking down. So the destruction of red blood cells or hemolytic anemia. One great example is sickle cell anemia or falciform anemia, just a different term. Sickle cell disease is a condition which red blood cells may be provoked into changing their appearance from a rounded disc shape to a sickle or falciform shape. You see, the normal red blood cells are like little hockey pucks, and the sickled blood cells are more like these spiky bananas. Normal disc-shaped blood cells easily slip through narrow blood vessels, but the crescent-shaped sickles have sharp edges which get trapped in narrow passageways and can cause obstructions, decrease blood flow, oxygen starvation, and this can lead to significant pain and often tissue damage or even tissue destruction. Now you see these sickles getting caught up in a narrow blood vessel there in the diagram. Sickling can be caused by a number of different events. Most commonly, exercise, which can cause a shortage of oxygen. Everyday stress can cause a sickle attack. Dehydration from either drinking less liquids or losing fluids, from sweating or diarrhea or fever, infection, smoking, and a whole bunch of other toxic exposures can provoke a sickling attack. Now, when you look at all of these stressors, all of these triggers, a common feature to these events is the increased production of free radicals and oxidative stress, both of which tip the balance of oxidation and antioxidation. Red blood cells are very prone to oxidative damage, and in the case of sickle cell disease, this damage is particularly severe. And the major substance produced by our body to prevent free radical damage and oxidative stress is the naturally occurring molecule glutathione. Glutathione is rapidly depleted in a sickle cell crisis, and its protective effect is greatly diminished. That's a bottom line here. Sickle cell patients have been well documented to have lower glutathione levels, and studies looking at raising glutathione levels in sickle cell patients have demonstrated much more favorable outcomes and prognosis. And this is just one article. Many similar articles can be found in the literature. Let's move on to a similar group of diseases where the shape of the red blood cells are changed and prone to damage. Two of these would be spherocytosis and ovalcytosis. Like sickle cell disease, both spherocytosis and ovalcytosis are conditions of abnormal red blood cells, and as the name implies, the red blood cells are either round, spheres, or oval in shape. These are not as stable as the normal cylinder shape seen in healthy red blood cells, and they're much more prone to damage, destruction, and removal from the bloodstream by the spleen, which serves as a filter. The spleen is filtering out abnormally shaped red blood cells. And many drugs and infections can trigger a breakdown of these abnormal red blood cells, and enlargement of the spleen results, which is working overtime, and it can become quite uncomfortable and problematic. Here we see the the spleen, and this will be enlarged because it's constantly removing these abnormal shaped red blood cells. One of the mechanisms of destruction of these cells is, again, through oxidative stress, abnormal oxidant-antioxidant balance. Not only have these patients been noted to have high levels of oxidation, but this is also associated with low levels of antioxidants. More specifically, glutathione levels are reduced, increasing the vulnerability of these cells even more. So increased free radicals and decreased glutathione, again, seen in these diseases. Another illness which red blood cells can become broken down is what we call G6PD deficiency, or FAVism. G6PD stands for glucose-6-phosphate dehydrogenase. This is an enzyme important in red blood cell metabolism. When this enzyme is abnormally low, as seen in certain hereditary diseases, the red blood cells become more fragile when exposed to certain medications, stress, or infection. And moreover, in the case of FAVism, to what we call broad beans, fava beans. And here you see a short list of foods that can provoke a G6PD deficiency attack. And this is actually something that's quite common, being present in hundreds of millions of individuals. This is very, very common. The mechanism in the pathway to destruction of these abnormal red cells is, again, oxidative stress. Dozens of studies have shown that these patients have abnormally high free radical damage and low glutathione protection. So strategies to raise glutathione levels, both in the laboratory and in humans, have shown improvement. And again, we use the term in the title slide, an underutilized strategy. Thalassemia is another cause of blood cell destruction. You can see in this slide here the malformed blood cells that we can see in thalassemia. Thalassemia is a genetic, it's an inherited disorder of hemoglobin. Hemoglobin is the major oxygen-carrying protein in red blood cells. There are several types, the most common being alpha thalassemia and beta thalassemia, and it appears in much higher frequency in people originating from the Mediterranean region. So Italians and Greek people, Spanish people, you'll find thalassemia much more commonly in these populations. And thalassemia patients have lower amounts of hemoglobin and more fragile red blood cells. And besides anemia, they're more prone to iron overload, also bone deformities and heart disease. So there are a number of things that can go wrong in a thalassemic patient. And glutathione is involved on several levels. And of note, iron overload is a strong source of free radical production and subsequent damage to tissue, cells, and molecules like DNA. So one unique feature of glutathione, you may remember, is its ability to chelate. In other words, bonds directly to excess iron and allows its elimination from the body. So efforts to raise glutathione levels in thalassemic patients have yielded promising results. Let's move from the destruction of red blood cells to decreased production of red blood cells, decreased production of these important red blood cells. Something called aplastic anemia is unfortunately a common cause of this phenomenon. Now, blood cells are manufactured in your bone marrow. And this is where the blood stem cells are found. Your stem cells to all your blood is found in the bone marrow. And when the bone marrow is damaged, all blood cells may be negatively affected, not just red blood cells, but also white blood cells and also platelets. So you have an anemia of red blood cells, but you also have a white blood cell deficiency and a platelet deficiency. And this damage can come from a number of different sources, including exposures to chemicals, drugs, radiation, infection. Unfortunately, in a great number of cases, the exact cause of aplastic anemia is never identified. Sometimes it remains a mystery. In the case of drugs and chemicals that can provoke aplastic anemia, the list of these substances that are detoxified by glutathione is well documented, including radiation exposure. Here we see a short list of drugs and toxins that are dependent on glutathione to get rid of, that can trigger an aplastic anemia. So this detoxification perspective of glutathione is quite profound. Another interesting observation made by geneticists is that many individuals who acquire aplastic anemia have abnormally functioning glutathione enzymes. So these abnormal enzymes predispose a person to the development of aplastic anemia. Let's look at Fanconi's anemia for a moment, not to be confused with Fanconi's syndrome, which is a kidney disease. Fanconi anemia is a genetic disease that results in a number of different problems, including anatomical abnormalities, a much higher risk of cancers, especially leukemia, and bone marrow failure, leading to anemia. And it's been established that one of the mechanisms leading to the problems in Fanconi's anemia is oxidative stress, again, which damages DNA. Recent studies done in humans have successfully delayed clinical symptoms by utilizing glutathione precursors. This offers hope in retarding the onset of cancer and anemia in this disease. Now, blood loss, this needs to be approached a little bit differently than the other things we were talking about. The blood loss is not directly associated with glutathione deficiency. So, but let's break blood loss into two categories: acute and
this meeting is being recorded.
Sudden and severe blood loss is most commonly encountered through accidental physical trauma, motor vehicle accidents, penetrating injuries, industrial accidents, and others, or through gastrointestinal blood loss, like through a stomach ulcer or an esophageal hemorrhage, or things like that. Raising glutathione levels will not directly address these pathologies, but it will benefit in the recovery from these situations. It's well documented that a great percentage of patients interned in an intensive care unit will be glutathione deficient. So low glutathione levels correlate with poorer outcomes. In contrast, raising glutathione levels in surgical patients has been shown to speed up recovery and also increase discharge rates from the hospital. Let's look at chronic blood loss. This is where you're just kind of leaking blood over weeks to months, and your anemia is a very slow, gradual onset. This could be due to a number of medical conditions, including menstrual difficulties, parasitic infection, gastrointestinal lesions, cancer. Glutathione depletion has been noted in a number of intestinal diseases, including Crohn's disease, ulcerative colitis, esophagitis, and more. So raising glutathione in these instances has been shown to be promising in alleviating symptoms. So you're taking care of the disease process by raising glutathione, which in turn can make the anemia less severe or even improve. Many patients with anemia suffer from iron deficiency anemia. Now, glutathione will not help iron deficiency anemia. The mainstay in treatment here is supplemental iron. So why am I mentioning it here? Now, iron supplements are not without adverse effects. And those of you who have taken iron know this. This is mostly due to the strong oxidative properties of iron, which provoke free radical damage. So glutathione is key in neutralizing the oxidative damage subsequent to iron free radical exposure. So we're using glutathione here as a way to treat the treatment, which is what we unfortunately do with many pharmaceutical drugs. So just in conclusion, there's such a large variety of conditions, both genetic and environmental, that can lead to anemia. This can be from inadequate red blood cell production, it could be from red blood cell destruction, or it could be from direct blood loss. And many interventions exist as there are reasons to become anemic. The mainstay of severe anemia often entails the use of blood transfusion, iron supplementation, and treatment of the underlying cause. But something that you need to keep in mind is the use of glutathione enhancing substances. This can be achieved through non-pharmacological means. You all know what I'm talking about here. Glutathione depletion is well documented in many types of anemia. More importantly, the aspect of raising glutathione levels in anemia has shown promise in multiple clinical studies. Now, given the safety profile of natural glutathione enhancing substances, they can be viewed as an underutilized strategy in addressing this very common problem. Here are just some examples of anemia that I think we should all think of, in which glutathione may be proven to be a simple and useful strategy to consider: aplastic anemia, Fanconi anemia, lead exposure, hydrocarbon exposure, marrow invasion, sickle cell disease, G6PD, thalassemia, and more. These are all keywords that if you talk to somebody about, you may be able to offer them a means of getting better. So here's the reason behind most of these problems discussed in this presentation. Consider free radical production, oxidative stress, or toxin exposure as an integral part of the disease process. All of these can be both directly a cause of glutathione deficiency, or in turn be caused by glutathione deficiency, and we all know the best way to address that. So thank you very much for your attention. For anybody that's interested in the topic of glutathione, there's always new information on my Facebook page, Dr. Jimmy Gutman, and many videos on glutathione, including recordings of this lecture series that you're hosting, Doug, can be found at Dr. Jimmy Gutman YouTube. To get the books, there's a few places you could go to. You could try glutathione.org. In Canada, there's a special site and the prices are a bit better, gshbooks.com. Or you could just go ahead and find it on Amazon. So it'll have tons of information, and on many of these sites, the information is updated all the time. So please feel free to pay a visit, drop a note, and increase your knowledge on glutathione.